Dr. Falls, and this is Luna. Luna comes to see her veterinarian at least once a year, but unfortunately for some cats this isn't the case. In fact, about 50% of pet cats in the US have not seen a veterinarian in the past year. There are a variety of reasons for this, but regardless of your reason, getting your pet to the veterinarian for a good physical exam is actually one of the best things that you can do to care for them. Cats are masters at hiding pain and illness, and even the most vigilant owner may not be able to tell when there's something going on with their cat. So today I'm going to talk to you a little bit about how I do a physical exam, go through kind of some of the most important things we're looking for and some of the most common abnormalities to hopefully help you understand why it's so important to try and get your cat in to see us. So what I like to do is I kind of work from the head back, and that gives me a rhythm so that hopefully I don't forget to do anything. So I'm going to start by looking at the face. I'm going to look at their eyes and make sure that they look clear. I'm looking for any signs of inflammation, drainage that might signal infection, any changes to the size of the pupils, as well as sometimes we will look at the retina in the back of the eye. I'm also going to look at the ears. Again, looking for redness, inflammation, signs that they've been scratching at the ears or that they're itchy. Sometimes we'll detect an odor that might signal an infection. The next thing I generally do, depending on the cat, is come down and look at their teeth. So I'm going to try and look all the way to the back of the mouth, examining them for tartar, redness and swelling in the gums, fractured teeth, and even sometimes growths within the mouth. So I'll try to get them to open their mouth at least for a second so I can see inside. Dental disease is incredibly common in middle-aged or older cats, and it affects not just their mouth but also their heart, their liver, and their kidneys. So it's very important to stay on top of that. I'm just going to try and offer her some treats to keep her happy here. Those are pretty good. Hey, Luna. Next, I'm going to come down. I'm going to try and feel some of their lymph nodes. So under the jaw here, we have 2 lymph nodes that may be swollen in times of infection, inflammation, or even certain types of cancers. They also have 2 lymph nodes sitting in front of their shoulder blades here as well. Then I'll generally turn them around. I'm going to just scoot. You can take your treats. Give me a, we're going to scoot you around. Whoop, 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 whoop. There we go. And I'm going to start listening to their heart. So I'm really listening for the rhythm of the heart. So is it a regular kind of lub-dub, or does it kind of scatter all over the place, which would be abnormal, as well as the rate. So is it fast? Is it slow? And Luna's purring, so it's making it a little bit difficult for me to hear, but sometimes we can get them to stop doing that. I'm also going to come up and listen to their lungs, looking for crackles and wheezes, or listening, sorry, for crackles and wheezes. For our cats that may have any type of asthma, this can be very important. Heart disease, listening for fluid in the chest. Then I'm going to come back and start feeling the abdomen. In a cat that's not too overweight, I can actually feel a large amount in their abdomen. I can even generally feel their kidneys. Kidney disease is very common, and so we can feel the shape and size of those kidneys and whether or not they're painful for the cat. Feeling for any organs that are obviously enlarged. Do they have a large liver? Do they have, a large spleen? And also trying to sense any pain in the cat as well. I know, most cats don't love their bellies being touched, but she's tolerating it. And then lastly, I'm generally going to come back and feel the lymph nodes that are behind their knees, so kind of working our way back. I'm then going to look under their tail as well, just to examine their back area. And I'll try and just run my hands over them to feel for any lumps or bumps and kind of look through their fur as well. So Luna's been really good here. She's had a very healthy physical exam, and she's a very happy girl. So we hope that you'll come in and see us. Now I know that one of the major reasons reasons that people don't come in is because their cats are very nervous. Cats don't like to get in the carrier, they don't like to get in the car, and they don't like to be here. It can be, for most of them, quite a stressful experience. So there are several things that we can do to kind of help you work through those situations, but one of the things that we've implemented is cat-only afternoons on Wednesdays. So from 2 to 5 on every Wednesday, we're going to try and see cat-only appointments, and this will help decrease the number of dogs that are in the hospital and in the waiting room, which seeing the dogs, smelling the dogs, hearing the dogs can be a big source of stress for these guys. So this will hopefully just make for a quieter and smoother experience for your feline friends at home. But anyways, we hope to see you soon. Have a good day.